Ask Chinese people to make a short list of their biggest concerns, and healthcare will be on almost every list. The much publicized cases of patients attacking doctors reveal broader systemic problems. Despite much efforts to improve healthcare, why are there still so many complaints? The public complains about overcrowded, understaffed hospitals. Doctors complain about being overworked and underpaid. Hospital management complains about increasing costs and insufficient funds. Moreover, what about gross imbalances in medical quality, especially between urban and rural areas? What about incentives to overcharge, like excessive prescriptions of drugs? And what about the anti-corruption campaign in healthcare? Healthcare reform is now a priority in China. What are the objectives of reform? The critical success factors? What's the optimum role of government? We talked to three experts. Professor Liu Xiaoyun works on social medicine and health statistics at Beijing University. Dr. He Xiaoxun is vice president of the largest hospital in Guangdong province at Sun Yat-sen University, and Professor Ren Jianming at Beihang University is a leading authority on corruption, especially corruption in healthcare. To understand healthcare is to be closer to China.
March 23, 2012, at one of Harbin's top hospitals, a 20-year-old trainee doctor, Wang Hao, was stabbed to death. The assailant was a 17-year-old Li Mengnan. Li was a rheumatology patient at the hospital. Doctors told him that he first needed to recover from other illness before he could take drugs for his rheumatism. Li Mengnan said he had become angry because he thought he had been refused treatment at the hospital.
I don't know him. The doctors kept postponing my treatment. They asked me to take numerous examinations, and I felt angry.
According to a report, in 2014, there are a total of 115,000 medical disputes in China. Tensions between doctors and patients are troubling Chinese society.
The strained relationship between patients and doctors in China seems to have developed only in the last few years. Why is this the case? There are many stories that we hear about patients attacking doctors, terrible things. But why has it happened just fairly recently? And what can be done to change it?
可以说这个医患关系紧张呢，应该说是社会关系的一个反射吧，应该是。
Well, I think tensions between doctors and patients actually reflect the big picture of social relationships, only that the medical sector reveals the problem more severely than other areas.
通俗来说啊，这个人生病哈是个倒霉的事情啊。
The reason is that, generally speaking, illness is a bad thing that costs money and threatens people's life.
这个心情不好的情况下，
When patients start with a bad mood and find it difficult to see a doctor in a medical system that is by no means well developed, there is a great likelihood of escalated tensions if the result fails patients' expectations. The problem's escalation speaks of the reason and also the motivation for medical reform at present.
China's healthcare reform dates back to the 1950s, when the country implemented its rural cooperative medical systems. The system at the time consisted of so-called barefoot doctors who were based in rural and remote areas, outpatient clinics that were run by state-owned enterprises, and county hospitals that treated patients with serious illness. The system significantly improved life expectancy in China from the 1950s to the early 1980s. Today, hospitals in China are organized according to a three-tier system: primary, secondary, and tertiary institutions. Primary hospitals typically are township hospitals that contain less than 100 beds. Secondary hospitals tend to be affiliated with medium-sized cities, counties, or districts. They contain more than 100 beds, but less than 500. Tertiary hospitals are comprehensive or general hospitals with all the medical specialties at the city, provincial, or national level, and with the bed capacity exceeding 500.
And at those three levels, approximately how many people would they serve at the village level, the township, or the county, just roughly?
Usually in the county level, it's 500,000 people. In the village level, several thousand people.
And township?
Township, 10, 20 or 20,000 or 30,000 sometimes.
In late 1980s and early 1990s, China's economic reform began to affect the country's healthcare system. Factories no longer ran their own healthcare clinics. Government subsidies to public hospitals began to decline. As a result, an increasing number of patients began to crowd tertiary hospitals for diagnosis and treatment. Public hospitals began to operate like private hospitals, and disparities in healthcare quality between urban and rural areas began to emerge. At the same time, due to the current salary system in public hospitals, doctors' salaries can seldom meet their expectations. This is especially true at the level of primary healthcare. That's when rebates from drug companies kicked in, both to hospitals and to doctors, and distrust between doctors and patients began to fester. Though a series of reforms were introduced between 1980 and 2000, the level of actual benefits remained low. Of all the issues, first and foremost is the disparity between tertiary hospitals in major cities and primary hospitals in townships.
So let's get on the table all the major problems of the healthcare system today. I mean, I can list a few. I mean, we have obviously big disparities between rural and urban areas. We have disincentives for public hospitals or private, and all hospitals, to efficiently allocate services because they have to pay for their own existence. Those are two big problems. So what are some other problems?
One of the problems in my mind, in my research experience, I think is for the public hospitals, I mean, they need to, what their role should be to provide service to people with some kind of severe diseases. So, and we have the primary healthcare facilities, including township health centers and the village clinics and the community health centers in the urban area. So they should provide primary health care. But we don't have a gatekeeping system. So the patient's first contact, they can choose any hospital they want. So this is a big problem in the current situation. So we want, what we want the country, the government want to achieve is to have a ordered health-seeking behavior. People, the first contact should be the primary healthcare system, and then only in some certain institutions they can be referred to the high-level hospital. This is to me, this is a very big problem now. And the second problem I feel is the quality of healthcare, especially the primary healthcare, because then people don't trust the primary healthcare. They choose the high-level hospital. So we need to develop the quality of healthcare in the primary healthcare level. In terms of the resource allocation, urban and rural areas still have a quite big gap. The disparity between rural area and is quite a big gap. We have some statistics, like, for example, the number of physicians in the rural area is kind of twice in rural area. Number of nurses 3 times than in the rural area. So this gap is still.
This is a statistic per capita or in total?
The number of physicians per 1,000 population, for example, the intensity of the resources, it's about 2 to 3 times higher in the urban than in the rural area.
We usually talk about the AAA or AA hospitals in China. If we look at the general structure of the current medical system, we have clinics at the grassroots communities, township healthcare centers in rural areas, and hospitals at the districts, counties, regions, municipalities, provinces, and then further up. National medical institutions in cities like Beijing and Shanghai. I think the system is totally okay. The problem lies in the allocation of resources. I think we have accumulated too many problems in the past, and it becomes very difficult to change the scenario within a short period of time. We face not only the problem of resources, say economic support and financial earmarks, but more importantly, we need to conquer the challenge of technologies. We have to deploy our talents to hit the nail on the head. Besides, we must be aware that such changes take time. It is very difficult to make dramatic changes.
Lack of primary healthcare is a major problem in China. Some say it is the most important problem that China must tackle. In 2009, the Chinese government announced an ambitious plan to reform its healthcare system. It invested $124 billion in its healthcare sector and achieved universal health coverage for Chinese citizens. But money alone did not bring about an immediate transformation to overcrowded hospitals. Dr. Chen is going to work at Peking Union Medical College Hospital. It is one of China's leading hospitals.
I seldom have time for water or bathroom during the day, so I have to get prepared. It's like heading towards a battleground.
The hospital employs many of China's leading medical experts. Patients come from all over the country to consult with them.
My mom and I visited many primary and local hospitals. The drugs they prescribed were not very effective. That's why we came to Peking Union Medical College Hospital.
I went to a community hospital in Chongping. The doctors prescribed some medication. After taking the medication, I felt my stomach was full of gas. That's why I started trying different hospitals. So far, none has cured my disease.
My wife got a lump in her throat. Doctors from local hospitals told us it can be cured through surgery. I think doctors here are more experienced, so we like to consult them before taking the surgery.
I didn't go to community hospitals because doctors there are not as experienced as those in Peking Union Medical College Hospital.
This means that it is very hard to get an appointment here, particularly in departments like Dr. Wang's, where it is country leading. On an average day in the clinic, Dr. Wang sees about 50 to 70 returning patients. This means about 6 minutes per returning patient.
It takes at least half an hour to treat new patients.
The overwhelming number of patients means there's no way one can provide them with the quality of care he would like to offer.
In today's healthcare system, what precisely is the role of the public hospitals, especially in large urban areas?
I think we have two levels of service delivery system: public hospital and the primary healthcare facility. For the public hospital, ideally, they should provide service to patients with complex and severe diseases, and the common disease and minor illness should be dealt with in the primary healthcare system. So this is the ideal system. But currently, because we don't have a gatekeeping system, so patients can choose their first contact freely, either hospital or tertiary hospital or primary village clinic. So their role is not realized in that way. So I think this is the first point I want to make. The second point is, in the national policy, we frequently mention the term public interest. So the public hospital should have public interest, which is to me, it's not a very clear term, what is public interest. But at least for one thing I'm sure is, for some patients who cannot afford the healthcare cost, there should be some mechanism for them to afford that kind of medical expenses occurred in public hospitals. But this is not only the role of public hospital, but also need some help from the health insurance system.
From emerging powers to expanding partnerships, from fighting poverty to combating climate change, booming economies, war-ravaged nations, and everything in between. We capture the changes affecting the most dynamic and diverse continent on the planet, taking you beyond the headlines to the people and their stories. Asia Today, delivering Asia to the world.
Huang is a doctor at one of China's tertiary hospitals. She's received 14 years of training, including 9 years of clinical research. She spent 3 years studying overseas. As a newly graduate, Huang made 300 yuan a month. That's about $500.
After around 8 years of basic training, I became a doctor, a surgeon. At that time, the salary is around RMB 3,000 to 4,000 per month. Later, when I graduate from the Peking Union Medical College and got my the doctoral degree, the salary I expected would be 10,000 RMB per month maybe. But actually, the truth is that the salary is around 5,000 to 6,000 per month RMB. After my postdoc training at Harvard, I got the position of a lecturer at another teaching hospital of Harvard Medical School. The salary they provided is 60,000 per year. That is $5,000 per month.
According to a survey by Chinese Doctor Association, because of the work pressures and low incomes found in the profession, nearly 80% of the respondents say they don't want their children to be doctors in the future. Only 6.8% of doctors said they hope their children would take their career path they had chosen.
Healthcare workers in general, and even doctors in specific, are not paid high salaries. In the West, in private doctors who have private practices can make a lot of money, so that attracts very good people. In China, doctors are not paid officially high salaries, and it's limited, especially in public hospitals. And what that does is it encourages corruption. It encourages people to get the best doctors by giving them so-called red envelopes with cash in it, and incentives from drug companies. I mean, this is not, in the West, I mean, drug companies have done the same thing, maybe much less so at the doctor level, because the doctors already get high salaries. How serious is this in terms of the healthcare system?
I agree that the salary level, income level of the doctors at public hospital or in the primary healthcare facility are quite low comparing to other professionals. It's slightly above the average level of the society. This is quite low comparing to the industrialized countries. I think there are two issues here. One is we really need to set up to reform the salary system, because it's not easy to address, because it's not only a health sector problem. You need to compare to the civil servant system, to the overall society's salary system. And the other issue is as we discussed before, is the profit-driven behavior. So to me, I feel that some policy need to be addressed at the public hospital level to set up some regulations to prevent doctors to have that kind of behavior, corruption or other unexpected behavior.
In addition to providing proper health care, the Chinese government must also overcome problems emerging from a profit-driven market. In 1985, China launched market-oriented healthcare reforms. Public hospitals were encouraged to generate their own revenues with the aim of mobilizing medical workers and improving hospital efficiency. But the reforms brought about unintended consequences.
When reform began, what happened to healthcare when the planned economy began to transform to the market economy? What happened to healthcare in that process? And then let's start with that. How healthcare was during the early days, during the planned economy, and what happened in the early days of reform?
Since early 1980s, along with the economic reform, especially after 1985, the system has changed quite radically. We have increased the autonomy of the public hospitals, but at the same time reduced the financial investment into the public hospital. So the public hospitals need to rely heavily on the service fees from the provision of medical services. Their behavior are more profit-driven to some extent.
Even though they're public hospitals, but the government subsidies, which used to be 100%, right, before,
yes,
100%, now they're not 100%, so they have to
less than 10%.
Less than 10%.
Less than 10% of their total costs are funded by the budget. So the rest, 90% have to be earned from the revenue of the service provision.
While doctors seek ways to make their hard work cost-effective, hospitals also struggle for ways to generate revenue. Rebates from pharmaceutical companies soon found their ways into meeting this demand. In July 2013, Chinese authorities put British pharmaceutical giant GlaxoSmithKline under investigation for suspected bribery and tax-related offenses. Mark Riley, manager of GSK China, allegedly pressed his sales teams to bribe hospitals, doctors, and other medical institutions and organizations through various means in order to gain illegal revenues in the billions.
Due to the extreme overcrowding of hospitals for doctors' time and the very low salaries that doctors are paid and traditional Chinese custom, it is commonly reported that there's a tradition where patients would give money to doctors, so-called hongbao, red envelopes. Not only that, but hospitals have been known to take money from drug companies to prescribe treatments that not necessarily are needed so they can get revenues because they need to generate revenues. So the whole financial system of healthcare needs restructuring. So I ask you, from the standpoint of doctors, how do doctors look upon the financial structure of the healthcare industry, and what's their recommendation for improvement?
现在公立医院啊，就是用于支付医务人员这个薪酬这一块，这个比例。
For public hospitals, payment to medical staff accounts for 30% of their expenditure. In America, the number is about 60%.
台湾也是超过50%。
So our data tell us how little Chinese medical staff earn for their performance. If we don't change the status quo, there will be problems sooner or later. According to investigations into public hospitals, for every RMB 40 out of RMB 100 that patients pay, 40% goes to pharmaceuticals and about 20% for facilities and equipment. These two make up 60% already. Then about 10% goes to miscellaneous fees like management, maintenance, and others. And so only about 30% is left for the salaries of medical staff. They can never really enjoy handsome pay. So we must do some structural change to drive down pharmaceutical prices, which matters a lot. Then equipment and facilities also cost a lot, even more than in the US. This is abnormal.
I myself have once done some research in this regard, and I put forth the question that in the planned economy in the past, there were also problems of malpractice and unwholesome tendencies, but corruption was never very serious. Why is it so as we go through economic restructuring towards a market economy? Personally, I think that in the transitional period, the market can play some role, but at the same time, the government imposes controls on the healthcare system. So the impacts from both the market and the government create many opportunities for corruption at this special point in time.
Let's talk more detailed about what some would call corruption in the system. Some analysts in China would say that corruption is not a problem in healthcare because a problem means it's something that's on top of the healthcare. But corruption in China is the foundation of healthcare. It's the only way it works. This is some of the criticisms that are made. It's the basis of the healthcare system is a kind of corruption where you have to pay doctors, either the drug companies have to pay the hospitals, or the hospitals are overcharging the patients or prescribing things that they don't need. So to the degree that this is true, what are the kinds of reforms that have to be put in place to change the real essence of how the health system is worked, the behavioral motivations, the financial motivations that lead to this behaviors of the system? I mean, how can you reform this?
First, I think the question is how do we reform the corruption? But the first thing I want to clarify is, although I don't have the overall picture of the corruption in the health system, but I don't think is the, as you said, is the basis of the health system. I don't agree with that part. We admit that there are some corruption behavior in the health system, but I don't know to what extent it is in the health system. I think the potential solution for that kind of behavior is in two parts. First, we need to set up the proper salary system, to increase their salary, to reflect their qualification, the risk they bear, and the hardship they bear. So the salary system should be right to prove, if there is a correct system there, the doctors and nurses, they won't do kind of that kind of behavior, profit-driven behavior. And the second part, I would say, is the government need to improve their regulation capacity. I think the quantity is quite weak to regulate the behavior of the doctors.
What kind of behaviors need to be regulated, and how do you even do that?
I think, to me, I want to emphasize on some of the governance structure of the public hospital. So the government hospital, because majority of the funds are collected from the service provision. So there are two kind of decision making in the public hospital. The first part of it is a big decision, because the public hospital are owned by the public. So the government should be the owner of the public hospitals. So they should, the government as the owner of the public hospital should make some big decisions, like to appoint a director of the hospital, to decide whether you want to develop a new hospital, to build a new hospital or not, to develop or close a department. So that kind of big decision should be made by the owner or sponsor of the public hospital. Another example is to what extent the director of the hospital can claim the profit, to use the profit, to allocate among the health workers. I think there should be a ceiling. The government should set up a ceiling of the profit, which the director can use to allocate within the and
anything above that has to go back to the system.
Sure.
Yeah, this prevents an overcharging.
I think that's the key.
Overprescribing.
Yeah. So these are big decisions to be owned by the government, not the hospital themselves. But on the other hand, there are some small decisions, I would call it small decisions, but the daily management, daily operation of the hospital, including the recruitment of new staff, including the financial management. How do you use financial incentive to motivate health workers in a certain department? So this kind of decision space should be decentralized to the director, to the hospital.
For China to achieve its goal of becoming a moderately prosperous society by 2020, the vast majority of the Chinese people must have access to quality health care, and this means rural as well as urban citizens. Here's my prescription, 7 suggestions. 1, the 3-tiered hospital system will work only when people trust primary care at the township level. Local doctors must be capable. 2, salaries of healthcare professionals, especially doctors at all levels, must be increased. 3, telemedicine should be prioritized, particularly in primary hospitals. 4, prescribing drugs and ordering tests must be decoupled from their financial benefits. 5, the private sector should increase its investment in management of hospitals and clinics, thus increasing competition in healthcare markets. 6, national medical insurance, a big step forward, needs to increase. 7, the government must find its optimum role, such as setting limits on costs, disincentives to overcharge, and clear rules for what constitutes corruption. The president of a major hospital told me that to blame hospitals and doctors for corruption is wrong. Blame the system, he said. Well, China is now determined to change the system, which involves other issues as well. For example, how can the private sector participate? We'll continue to explore healthcare reform to get closer to China.